body scan before Wegovy containing Semaglutide or Zepbound containing Tirzepatide can give doctors a baseline before major weight loss begins. A whole body scan separates fat from lean tissue, including muscle and other non-fat tissue. A lower number on the scale does not show whether the person mainly lost fat or also lost too much lean tissue. The quality of the weight loss matters. The practical question is simple. Can this person lose a large amount of weight while keeping enough muscle and strength? A baseline scan can help answer that question. It can show whether someone begins treatment with less lean tissue than expected, even when body mass index looks high. Wegovy and Zepbound reduce appetite and usually lower calorie intake. The body then uses stored energy, so fat mass falls, but some lean tissue can fall too. A starting measurement gives doctors something to compare against later instead of relying only on the scale. The most common test is a low-dose X-ray scan that estimates body composition. It measures fat mass, lean mass, and minerals in bone. A whole body scan can also show where fat and lean tissue are distributed, including the arms, legs, and trunk. Why does body composition matter during treatment with Wegovy or Zepbound? Because two people can lose the same amount of weight and end up with very different results. One may lose mostly fat and preserve strength. Another may lose too much lean tissue, become weaker, and struggle more with daily activity. Consider two people who each lose 20 pounds. The first keeps eating enough protein, continues resistance training, and stays active. The second eats very little, stops strength exercise, and becomes weaker. Their scales show the same 20-pound loss, but the quality of that weight loss is very different. A baseline is most useful when the scale may hide low muscle reserves. An older adult can have a high body mass index and still have very little leg muscle. Someone who has repeatedly lost and regained large amounts of weight may also start treatment with less lean tissue than expected. Doctors sometimes describe this pattern as excess body fat, combined with low muscle and reduced strength or mobility. The important point is simple. A larger body does not always mean a person has enough working muscle for daily life. A whole body report can show total fat mass, total lean mass, and measurements from different body areas. Some reports also show arm and leg lean mass, trunk fat, and numbers that account for body size. Those measurements can reveal problems that body weight alone cannot show. The scan's lean tissue estimate includes muscle, water, organs, and other non-fat tissues, so lean mass is broader than muscle alone. That is why the scan works best when combined with strength and function. Those measurements become more meaningful when they match what the patient can actually do. Simple functional checks can add important context. Grip strength, repeated chair rises, walking speed, and stair climbing can reveal changes in function. Usual activity also shows whether someone is staying stable or becoming weaker while the scale falls. The patients who may benefit most from baseline body composition testing are those with a higher risk of muscle loss. That includes many older adults and people who already feel weak or have limited mobility. It also includes people expected to lose a large percentage of body weight. The result should change something practical. If lean tissue is already low, the treatment plan can emphasize protein intake, resistance exercise, and strength tracking. That finding can also help the doctor avoid pushing weight loss unnecessarily fast. The scan becomes useful when it changes what the patient and doctor actually do. Strong appetite suppression makes protecting muscle especially important. Some patients on Wegovy or Zepbound feel full so quickly that they start eating tiny meals. If protein and total calories fall too far, weight may drop quickly, while the body receives too little material to maintain muscle. When appetite is strongly suppressed, each small meal should deliver more protein and nutrients. Eggs, dairy, fish, poultry, beans, tofu, and appropriate protein shakes can raise protein intake. They can do that without forcing patients to eat large portions when appetite is low. Protein needs are not identical for everyone. Age, body size, kidney function, activity, and total calorie intake all matter. But the basic goal is consistent. During major weight loss, enough protein should be built into the eating pattern to support lean tissue. Resistance exercise is the other major piece. Muscles are more likely to be preserved when they are regularly challenged. Machines, free weights, resistance bands, and supervised bodyweight exercises can all work. The exact method matters less than giving the muscles a reason to stay. Walking is valuable for cardiovascular health, mobility, and overall activity, but walking alone does not replace progressively challenging strength work. A patient who walks every day can still lose muscle if resistance exercise disappears while calorie intake drops sharply. The rate of weight loss matters too. Preserving strength is more important than pushing for the fastest possible loss. Rapid weight loss combined with very low intake and declining strength should prompt the doctor and patient to review the plan. A lower number on the scale is not enough if the patient is becoming weaker. That review can include the medication dose, calorie intake, protein intake, exercise, and symptoms. Persistent vomiting, dizziness, falls, or declining strength are especially important. These signals can show that the current plan is pushing weight loss faster than the patient is tolerating well. A repeat body composition scan can be useful when there is enough time for real change to occur. The goal is to track the overall pattern. Less fat, reasonable preservation of lean tissue, and stable or improving strength indicate progress. Not everyone needs the same level of body composition monitoring. For a younger, active patient with good strength and no signs of muscle loss, a baseline scan may add less information. Weight, waist measurement, food intake, and strength trends may already provide enough guidance. The scan is most valuable when it can uncover a risk the scale is hiding. If your doctor orders a body scan before or during Wegovy or Zepbound treatment, ask what result would change the plan. Would low lean tissue change protein goals? Would it change strength training? Would it change how quickly the dose increases? Those questions tell you whether the scan has a clear purpose. The best use of the scan is to identify a problem early enough to act on it. A useful scan connects directly to nutrition, resistance exercise, weight loss pace, medication decisions, and follow-up during treatment. The scale tells you how much weight was lost. Body composition helps tell you what was lost. Strength and function help tell you whether that change is helping or hurting. Those three pieces together give a much clearer picture of the quality of weight loss. For people at higher risk of muscle loss, that baseline can be valuable before major weight reduction begins. Wegovy and Zepbound can produce substantial fat loss. The goal is to protect enough lean tissue and strength so that a smaller body is also a stronger, healthier body. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.